Good afternoon, everyone. My name is Rami, and I will be examining whether amnesic patients with Korsakoff syndrome use feedback when making decisions under risky conditions. A little background on this syndrome is Korsakoff syndrome is a chronic memory disorder caused by a severe deficiency of thiamine, or vitamin B1. This is caused by a long-lasting or excessive alcohol abuse. This causes damage to the cerebellum, prefrontal cortex, and diencephalic regions in the brain. Some symptoms include severe anterograde as well as minor retrograde memory deficits, deteriorations in processing temporal information, and executive control reductions. These symptoms are similar to what we saw in class with frontal lobe patients. Patients with frontal lobe damage or abnormalities, or even lesions to our limbic system, exhibit difficulties with decisions with ambiguity, which are rewards and punishments, which can be measured by the Iowa gambling task as well as the game of dice task. So it is unclear whether decision-making deficits in patients with Korsakoff syndrome in risky situations are caused by executive dysfunctions or by impairments in processing feedback or by both. To address this question systematically, they examined decision-making under risky conditions in patients with Korsakoff syndrome with the original task and a modified version of this task in which the feedback components were removed. The methods used in this experiment, as previously discussed, are two different tasks: the original game of dice task and a modified version of this task that doesn't provide any feedback. The original game of dice task is a computerized gambling task that explicitly provides rules for monetary gains and losses, and fixes the winning probabilities accordingly. Individuals are instructed that their goal within the game is to win as much fictitious money as possible and to lose as little money as possible. In the modified version of this task, you receive no feedback, no number that you roll, no predictions, no indications whether you got it right or wrong, no feedback whatsoever. So they investigated the role of feedback processing in decision making under risk conditions in two groups of 50 patients. One group were the amnesias due to Korsakoff syndrome, and the other group was a control group. Half of the groups were given the game of dice task, and the remaining were given the modified version in which no feedback was required. The other group of 50 patients, or the control group, were also given the same conditions, but they were healthy patients to see whether there was any deviations or anomalies within the two groups. The results of this study showed that patients with Korsakoff syndrome who performed the original game of dice task and those who performed the modified version of the game of dice task did not differ significantly. However, in the healthy subjects group who performed the original task had significantly higher net scores than the modified version of this task. This shows that subjects perform better when feedback is provided compared to with no feedback, while Korsakoff patients did not benefit from feedback. These findings imply that the feedback about the current decisions can be used by the healthy subjects to increase the final outcome, while the Korsakoff patients lose equally much fictitious money in both versions, the no feedback or the feedback given game of dice task. As you can see on the top left, the profile of the game of dice task performance in these two groups, the Korsakoff groups in A, the top, and the two control groups in B. In the patients, the profile did not differ between those subjects who performed the original game of dice task compared to those who performed the modified task. In addition, there was no statistical significance between the single alternatives. In the control group, there was a significant effect of alternative. They chose the safe option, the 3 numbers and 4 numbers, which is significantly more frequent than the risky alternative. This gave a 66% winning chance probability, more frequently than the risky alternative, the 1 number and 2 number, which was a max of 16%. Statistical analysis can be found within that chart as shown in the beginning of the lecture. Single comparisons of the alternatives revealed that one number was significantly different from all other variables. And results on the top right diagram of the neuropsychological tests of the Korsakoff patients who performed the original game of dice task and those who performed the modified version you can see that there were no significant differences or standard deviations between the two groups. In the bottom figure, the scores derived from the game of dice test of the Korsakoff patients and the control group divided into the subgroups of these patients to 25, 25, 25, 25 were performed and seen by the different types of tasks given. The statistical values for these single comparisons can be found in this diagram, which indicate that there were no significant differences in the Korsakoff patient's task, but there were a dramatic difference between the control group given feedback and the control group without any feedback. In conclusion, the analysis of performance on both the game of dice task and the modified version of this task suggests that healthy subjects perform better when feedback is provided. In the original game of dice task compared with the modified version, healthy subjects have a higher net score. They choose the riskiest alternative less frequently and have a higher final monetary balance. The Korsakoff syndrome patients perform inferior compared to the healthy subjects, irrespective from the game of dice task versions. The effect of the game of dice task version seen in the healthy subjects is not present in the patients at all. The performance scores, net score, the final balance, frequency do not differ between patients who perform the original and those who perform the modified version. This indicates that patients with severe anterograde amnesia, in the case of Korsakoff syndrome, perform similar on a decision-making task whether feedback is provided or not. Healthy subjects perform significantly better when feedback is given over no feedback. Decision-making under explicitly risky conditions in patients with Korsakoff syndrome patients emphasize the view that these patients exhibit reduced decision-making abilities due to dysfunctions in both executive and cognitive components and feedback processing. This study through the control group suggests that we utilize feedback in the decision-making process to calculate the best option possible. This is also shown in the Iowa gambling task, where structures such as the amygdala and orbital frontal cortex that process emotion also plays a significant role in decision-making. We conclude that in amnesic patients with Korsakoff syndrome etiology, feedback cannot be used to guide decision-making under explicit, risky conditions. Irrespective of whether or not feedback is provided, patients with this syndrome show a preference for the risky alternatives that is linked to reductions in executive function, similar to frontal lobe damage patients. Results indicate that for using feedback to guide decision-making, executive functions, and learning abilities are important, and that feedback cannot be used when patients suffer from amnesic syndromes.